You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have Dr. Leke Olowokere. Dr. Olowokere, welcome to the program.
Thanks for having me. It's a pleasure to be here.
All right, now you brought a stack of photos, so we're going to try to get to as many of those as possible. Now, for people that don't know your center there, who's the typical dental implant patient?
Yeah, so we don't really have a typical patient. We have very unique patients. All of them have very broad backgrounds and stories and things like that. But we do have two main groups that a lot of patients fall under. Okay. One group is going to be the patient who has teeth. And a lot of these patients will have a lot of infection, a lot of bleeding gums. They're in a lot of pain. They're just really miserable, really, with their teeth. Every time they think about their teeth, they're just not happy. And they know that things are going south very quickly. These are the patients that will really be able to help in a sense of preventing that unfortunate future of them being in a denture, number one. And then number two, just helping them to feel better. A lot of these patients have a lot of infection in their mouth. And because of that, we all know that our mouth is kind of a gateway to the rest of our body. So we're able to really be able to not just treat what's up here, but really treat the rest of their body by getting rid of a lot of that infection, okay? So for those patients, we're really able to help them in a sense of being able to provide them a new set of teeth, upper and lower fixed teeth that are locked into the jaw, and really just a healthy mouth. They're just healthier overall, and we're able to really be able to help them in that way.
All right. What about the second group?
Yeah, so in the second group, we're going to have these patients who are already in a denture. So these patients, a lot of them have been in a denture for a year, maybe 5 years, maybe most of their life.
Okay.
Some of them are very used to the fact of having to put all the adhesive on the denture. Some of them aren't used to it and have never gotten used to it. Some of them just don't really like it at all. So these patients already have a denture and they miss being able to taste food. They miss being able to be able to chew food. They miss being able to, I don't know if you've seen the video of the older lady who's skydiving and her dentures kind of fall out of her mouth. Yeah. So as unfortunate that is, a lot of these patients have that fear of being in a social setting and just talking, and then there goes a denture, So a lot of these patients are facing, and we make good cosmetic, good fitting dentures, but a lot of these issues are innately intertwined with just the nature of a denture, a loose denture. It's just there's a lot of problems with them. These are the patients we're able to really turn the clock back quite a bit and be able to give them a set of teeth that they're able to chew with, function with, taste food, and not really worry about having their teeth come out of their mouth.
So an upper and lower set of teeth supported by dental implants.
Yes, sir.
That don't come out.
Exactly.
And are there a lot of denture wearers where you are? There's a lot of people either headed or wearing a denture?
Yeah, so I wouldn't even say where we're at. Even to zoom out, I'd even just say in the U.S., there's studies that have shown that over 30 million people in the U.S. are missing at least half their teeth. Yeah, so a lot of people are in dentures right now. Zooming into just our Northwest Arkansas area in our metro, we're talking tens of thousands of people. Tens of thousands of people. That's a lot of people, even to quantify that.
So would you say thousands, tens of, over 100,000 in just Arkansas that have an upper lower denture?
In Northwest Arkansas, I wouldn't be surprised if that number was closer to 100,000 people.
Okay.
That's enough to fill up just about any stadium. Razorback Stadium, where our football team plays, Arkansas Razorbacks, fill it up with denture wearers. The Amp Theater, fill it up at least 5, 6, 7 times. So there's a lot of people.
So if it's so good and there's so many people in Arkansas with an upper lower denture, why aren't they all doing this?
Yeah.
What's your take?
Great question. I could go on and on with that answer. Let me give you about maybe 4 reasons. Okay. Number one, a lot of denture patients don't know it exists. They have no idea. If you can imagine a person who's been driving the same car maybe for decades, and they've never seen a new car before. It would amaze them that, hey, you can actually have a little screen on the car where it tells you where you're going, where you're backing out. All the little things that we kind of see with modern cars now that we're just kind of like, hey, that's just how it is. A lot of denture patients are stuck in the past and they just don't know that this even exists.
Because why? They don't go to the dentist?
They don't go to the dentist.
Okay.
They're kind of out of the system. Once you get your dentures, a lot of times they're like, well, I don't want to really go back. I got my dentures, I got my teeth. I'll live with them. This is life now for me. So a lot of these patients just don't even know they exist. They're oblivious to the fact that you can have a set of teeth that are locked into your jaw, that don't move, that don't come out. They just don't really know that it exists. Okay.
Nice.
So that's one reason. Another reason is also denture patients. But some of these patients have just had a terrible history with dentistry, to be frank. A lot of these patients, like I was saying earlier, and I have some patients that I can talk to you about this, a lot of these patients have had a bad history of having crowns that went bad, cavities that hurt, extractions, yada, yada, yada.
Lots of money to fix it.
All this money to fix it, to the point where they're like, hey, I just want to be done. I'm done working on my teeth. Just pull them all out and let me have some dentures. So once they get to that point, even if they know about dental implants, they don't want to go back. They don't want to experience all that trauma. They don't want to go back and relive all that, not knowing that nowadays we have technology.
So it's the fear that keeps them from doing it.
It's the fear.
How old can you be to get this done?
Yeah, so I've had a patient who was 92-year-old.
Really?
92-year-old.
Why would a 92-year-old want to do this?
So they can eat, so they can chew, so they can live the life that they haven't been able to live probably in decades.
So that 92-year-old,
yeah,
were they wearing a denture before?
Yeah.
And you gave them upper and lower teeth that didn't come out?
Well, she was wearing a denture that she never wore.
Okay.
She had a denture that she hated so much it ended up in the little drawer in her bathroom. So she had dentures, never wore them. They hurt, fell out of her mouth constantly, and we were able to give her a set of teeth, upper and lower teeth that were locked in, did not move. She can eat whatever she wants, doesn't have to worry about her teeth coming out. And she's truly happy that this last seasons of her life, she's able to experience something that she hasn't been able to experience in a very long time.
So when a 75-year-old is in your office and says, Doc, am I too old?
I'd say
so it's not even close to too old.
Not even close. Not even close when you're 75. I'd actually say most of our patients fall within that 60 to 70-year-old range, and they're the patients that feel like they're too old. I say they're a spring chicken compared to some of the patients that we've seen.
We should mention, I guess everything we're talking about today, you teach other dentists about implant dentistry.
Yeah, it's a passion of mine to be able to educate just some of my colleagues and whatnot as far as what's possible. It's truly a pleasure to be able to do that.
Okay, good. You brought a stack of photos. What are we looking at over there? Now, these are all people that, like, their option would have been a traditional denture,
right?
Which I know you guys do,
sure,
but they wanted more.
Yeah,
is that right? Okay.
Yes, sir. Yes, sir. So this lady, she came in, had a set of dentures for decades, so for most of her life. Never even wore them really, just because they hurt, they moved around. She really wanted a set of teeth that stayed in her mouth.
Okay.
So just kind of seeing her and being able to look at her gums and her jaw and really her smile, just her nature, her personality, I knew we were going to give her a set of teeth that she loved the way that they looked, that she loved the way that they functioned, that they stayed in her mouth. And we were able to do that. Now, this patient also, she was told previously that she just didn't have the bone to be able to get.
Yeah, but isn't that true? If you've been wearing a denture like 10 or 15 years, you can't do this. You don't have enough bone.
Not at all. Not at all. There's a lot of patients who are in that exact same boat, been told by provider after provider, and maybe for that provider's experience, they don't have enough bone. But with the amount of reps that we get, the amount of times that we're actually able to see patients and look at bone and utilize the amount of bone that patients have, we can treat just about every patient that walks through the door, and she was no stranger to that.
Very nice. Let's take a look at that. Is that her?
This is her. This is her. She is glowing right here, as you can see. She has a set of teeth that she loves. She has a set of upper and lower teeth that she truly is happy with. She has a lower snap-in set of teeth that are locked into her jaw. She's able to eat foods that she couldn't eat before, and really not worry about her teeth coming out, especially during social settings.
Is this one of those things where they say, Doctor, I wish I would have done this years ago?
Yes, a lot of patients say that. We're very familiar with hearing that. Because a lot of these patients, kind of going back to what I was talking about earlier, they just didn't know that it was even possible. And even the ones that knew that it was possible, they were just kind of like, well, why me? You know, maybe I shouldn't. I don't even want to go back to the dentist. But she was one of the people that also said that. Why didn't I do this earlier? So Randy, when you look at these two photos, wouldn't you say the one on the right just looks a little bit more like she's younger? She might have aged herself, maybe about 5 to 10 years younger, maybe a little happier, maybe a little
even
bit
more sophisticated.
A little bit more sophisticated as well. It's crazy what teeth can do for you. At least the perception of other people of you as well.
Do they feel judged? I think you told me that. People with bad teeth and gums.
A lot of patients are. It's unfortunate, but a lot of patients are, or at least feel judged by other people. And when you're feeling judged by somebody else, it kind of makes you self-insecure.
Like judged like what?
Judged in the sense of maybe not wanting to speak to them, maybe feeling like they're uneducated, maybe feeling like they're not happy people.
Or poor. Like I think we talked about this on the phone. It's like in movies.
Sure.
Like when they want to make somebody look bad, they give them bad teeth.
Exactly. Or they just kind of take out that one front tooth, and it just kind of makes them look like they're, like a little bit more unprofessional. So a lot of these patients, they felt that for a very long time, for other people judging them. And if you feel judged by other people, you start to look at yourself a little bit more negative too. you might start to become a little bit more
right?
angry. You might become a little bit more less social. And when you do that, other people, so it's just kind of like this tennis match, and your feelings and your ability to express your emotions just get less and less. So when we're able to provide dental implants and teeth to certain patients, it really allows them to be able to express their emotions in a way that they probably couldn't have before.
What about pain? I mean, it does seem painful.
No, actually something I hear quite a bit from most of my patients is after we even finish the procedure, they say, that wasn't as bad as I thought it was going to be.
Okay.
These are my patients that they say, I don't speak for them, they say that. They say, hey, that wasn't as bad as I thought it was going to be. Every patient is numbed up. I tell every patient before we start our surgery, I say, you are in the driver's seat. So if anything's uncomfortable at all, if anything's hurting you, just let me know. Even above that, we have sedation options. We have different levels of sedation. A lot of these patients don't even remember the procedure at all.
Is that right?
So it's not like how it used to be, where dentistry was just sit down, let me do my work, regardless of what you're feeling, and then you get out.
So it's IV sedation?
Yeah.
So you look at, what are you monitoring?
Yeah, so we have a provider who comes in. So I do my work. I'm focused on the surgery, focused on my patient's smile, focused on making sure they're getting their care. And we have another provider who does a fantastic job monitoring their vitals, which is things like their heart rate, their blood pressure, making sure that they're healthy, that they're okay during the procedure. Okay. So we're able to really provide a safe treatment for
What about the next
patients.
day? The next day, what's that like?
Yeah, so most of our patients the next day, they're a little sore. It's surgery at the end of the day. But a lot of these patients, just like I said earlier, they say, Doc, I thought I was going to be feeling a lot worse than I am right now. I'm a little sore, but I can get up, I can walk around.
Now you offer like pain medications, but many people just take over-the-counter stuff?
So a lot of patients just take over-the-counter Tylenol, ibuprofen, things like that. And it does it. Rarely do I prescribe narcotics. Rarely do I provide these opioids that used to be given out like candies, to different patients. We just don't really see that much in our practice.
So it's so don't let pain keep you from doing this.
Not at all.
That must be a big fear, though, right?
It is.
On the consult?
It is for a lot of patients. So our consults can be very emotional because a lot of patients have baggage. They come in with a lot of baggage, and we have to unpack that.
A lot of bad dental experiences?
A lot of bad dental experiences, a lot of bad just pain, a lot of bad just experiences going and just not having a real answer to their problem. Feeling like they have to pay money just for another problem, pay money for another problem. So we have to unpack a lot.
I think you call it like patchwork. What does that mean?
Yeah, so a lot of patchwork dentistry really just means that a patient would come in, maybe get a filling, became another cavity underneath that filling, would get a crown, the crown would come off, another cavity underneath that crown would turn into a root canal. So just a long wind of a whirlwind of different treatments that really don't solve the problem. Maybe they solve it for just a little bit of time, maybe a year or something like that. But then another issue would happen, and then they'd fix that. Then another issue would happen. So it's just this spiral.
So is this a way of fixing it once and for all?
Yes, sir.
Like you called it a new set of teeth.
It's a new set of teeth. It's a way to fix those issues of not being able to chew, fix those issues of being in pain, fix those issues of not having a smile that you're confident with. It's a very permanent treatment that we're able to provide patients with, make them happy, joyful, be able to live the life that they used to live. Yeah, so let me show you this next patient. This is Miss Danielle. Very awesome person, awesome personality, very joyful person. So she actually came in because she had a front tooth. It was a little bit loose, it was hurting her. And she said, Doc, can we just do something with this one tooth? Well, we did our x-rays, we did our examination. And I told you these consultations can be a little bit emotional because we're unpacking all the baggage.
Yeah.
We said, Miss Danielle, we're taking a look at all the teeth. And I know we're focusing on just this one, but I see infection basically everywhere. And when I said that, it's almost as she knew, as if she was just kind of keeping it to herself. And she kind of knew. She's like, yeah, that's kind of what I was scared of. So I kind of talked to you earlier about those patients that know that there's a lot going on and they know they're heading towards a denture, but they don't even want to look at that future. They don't even want to say that that's a possibility. So let me just out of sight, out of mind.
Okay.
Well, she kind of fell into that boat too. And after taking a look at all her teeth, we looked at all of her teeth and they weren't really savable, a lot of her teeth. And she knew that. She knew that a lot more than just that one tooth was hurting her. She knew that she felt like there was bad taste, infection, and things like that.
Okay.
And she knew that she was heading towards a denture. So that kind of opened the door of the discussion of, okay, what is best for you overall? And what we ended up doing for her was being able to give her a new set of teeth. healthy mouth, infection-free, new set of teeth that are locked onto her jaw, upper and lower teeth that are supported by dental implants. And let me show you this after. She was glowing before. She was glowing on this day. Let me tell you, she was very happy, joyful person, speaking 100 words a minute. She has been one of my favorite patients. Looks beautiful. She's able to eat the foods that she wants. She even told me, she said, "Doc, I feel healthier. Like ever since I had this done, I just feel healthier overall. I don't know how to explain it, but I just feel good. I feel good about my smile. I'm able to express myself in ways that I haven't been able to do in a long time. I don't have to worry about my teeth being loose." She's just a happier person now. And it's an honor really to be able to join her during that process. So let me tell you this next patient. This one's very, very special. This is Miss Sarah. Known her for a long time. She is a patient who, when I initially met her, she had teeth, a lot of patchwork dentistry, as we were talking about, a lot of fillings that turn into crowns, that turn into root canals, that turn into more cavities. So she knew something needed to be done. She also had a disease called xerostomia, which just means dry mouth. And what we know about our saliva is that it actually protects our teeth. So when you don't have any saliva in your mouth, your teeth are very prone to infection, to cavities and things like that.
No matter what, with dry mouth, you can't save your teeth, usually.
Usually it doesn't help you. I'll say that. It hurts you quite a bit when you don't have saliva in your mouth. So she was a patient. Whenever I met, she knew that she was headed towards the denture. She accepted that. She said, "Doc, I just want to be out of pain. Let's start there." So she was a patient that we actually did her treatment in phases over the years. We extracted her teeth, gave her a denture. She was happy to be out of pain. She was happy to be able to have teeth that she liked the way that they looked. But just like a lot of these denture patients, she experienced just that dissatisfaction with having dentures, having to put all the adhesive on it, worried that they're going to fall out, not being able to chew the foods that they liked.
So secretly, because I know you guys do a lot of dentures there, you told me. Sure. Is your goal like, boy, if I could just get them into upper and lower teeth that don't come out?
Yes.
That would be the best way to go.
Patients will tell me, "Doc, what should I do?" I say, it doesn't matter what I think, but I'll tell you from our most satisfied patients have a set of teeth that are supported by dental implants that do not come out because they know that this is what life used to be like.
Is that what you did for her?
This is what we did for her. So we're able to give her a set of teeth that were supported by dental implants. And let me show you. Number one, one more thing about this picture. Look at her face in this picture.
Yeah.
She's smiling ear to ear. Who's smiling before surgery, right? Who's smiling? Somebody who has hope in what's about to come. So this is what I see right here. This is us after the surgery. This is after we're able to give her some teeth that are supported by dental implants. Same joy, same glowing personality, but now she has the smile.
I'm not trying to side with you, but this is a good looking smile. I think anybody would say that.
Fits her face. This is her smile.
Boy, she looks so much younger.
A lot younger. She's happier. She's more positive. Actually, after we gave her teeth that night, she sent me a picture. And what the picture was, it was a burger. Oh, no text. It was just a burger with a little bit of a bite mark out of it.
That's good. ...
"Doc, I did it." I said, "You did it. You took a bite of her sandwich." She hadn't been able to do this in over 5 years. Be able to just take a bite out of a sandwich. And she was able to do this with her teeth. So this is another thing that I love to see, be able to turn that clock backwards and be able to provide patients with the life that they used to have.
Now, is this the future of dentistry? Whether it's 20 years or 50 years, traditional dentures, as we know them today, maybe they won't exist. Teeth will all be attached to something, like implants. Do you think that?
I think
so.
Future? I think so. Actually, I know so because a lot more patients are becoming more aware of this type of treatment. It's not that special thing that only the select few can be able to obtain. I think most patients nowadays are able to see that, hey, my cousin, my mom, my friend, they have these things called dental implants and they're actually happy with them. So I think over the years, people are just going to know more about that and know that they don't have to limit themselves anymore to a traditional set of dentures.
Very nice.
Yeah, so this is another patient right here. So we hear a lot, "Doc, I'm too old," right? So this is a patient, young at heart, beautiful woman on the inside and the out, about in her early 90s. So when I first met her, she came in with her husband and she said, "Doc, I know my teeth aren't bad, but I'm old, so I don't really know what to do. I want to be able to eat again, but I don't know how much longer I'm going to be here for." I said, "Miss Mary, if you were my mom, I'd recommend this for you. You do have teeth that are broken down." And this is me hearing her. She told me that she has teeth that are broken down. She has teeth that are hurting and she really doesn't want to be in pain anymore. And she'd like to be able to chew a steak at least one more time in her life. She just wants to be able to chew a steak. So after hearing a lot of these things, really I recommended to her, "Miss Mary, these teeth are no longer savable, But you have the bone, you have the support to be able to give you a set of teeth that are locked in, that stay in your mouth.
92.
At 92 years old. At 92 years old. So this was her, joyful woman. This is after her surgery. She was able to get a set of teeth that she loved. Very sentimental moment.
Big difference.
Very sentimental moment with her. So her husband actually didn't have much vision in her eyes, so he couldn't really see too well. After her surgery, like a lot of our surgeries, we're able to give them a set of teeth that same day, locked in with dental implants. Her husband came in real close. He couldn't really see, so he came real close to her.
Okay.
And his face just lit up. Just seeing his wife being able to smile in a way that she hadn't been able to do it before in the past. Now, she's a smiley person.
Now, at 92, were you nervous as the guy doing this?
I wasn't nervous.
Aren't they more likely to fall out if you're that age?
So I wasn't nervous because I only do things that are predictable. I can look at their x-rays, I can look at their scans, I can look at their medical history and know if something's predictable. Now, some patients may come in, they have medical conditions and comorbidities where we need to proceed in a different kind of way. For her, she was actually pretty healthy for her age, so I wasn't worried at all with her surgery.
Very nice.
Yeah.
And how soon can they eat?
That night. That night they can eat. As soon as they get their teeth.
Do they take it easy at the beginning, and then before you know it, they're eating
exactly
chewy things, whatever?
Exactly, because it's a new set of teeth. So I definitely tell these patients to keep it softer at first. Just take it easy. You know, you just had surgery, so try not to run into doing things. I have had a patient that felt so good after surgery that literally the next day he was trying to eat an apple. I said, slow down, don't do that.
Okay.
One day, not yet, because they did just have surgery, but they can eat.
Now, she's 92 years old. Did she end up liking the way it looked or what she can eat? What'd she like more? Do you remember?
Both, really. I mean, I wish I could say one or the other, but she loved both. She hadn't had a smile that she was truly happy with in decades. So She loved the way it looked. And then she got to eat her steak, like I was saying earlier. She got to eat that steak and truly enjoy all the flavors and things like that and really be able to chew it up. You know, a lot of these patients with their broken down teeth, they're not able to chew the foods that they want to eat. That can lead to digestive issues and things like that. She was able to chew her food well, enjoy all the flavors. So to answer your question, both, really. There wasn't one or the other. And that's what happens with a lot of these patients. Honestly, a lot of these patients will come in feeling like they just want one or the other. They say, Doc, I just want to be able to chew again. Okay, we can do that. We give them their new set of teeth. They come back, they're dressed a little bit different. They kind of look at themselves in the mirror a little bit more. It's like, okay, so you like the way the teeth look? They're like, yeah, Doc, like I get a lot of compliments and yada, yada, yada. And that's all they even talk about. They just talk about how it looks. I'm like, didn't you say that you just wanted, I don't bring that up in the back of my head. I'm just thinking, didn't you just say that you just want to function before?
Are you ever on a consult hearing their hard luck story? They've already told you they're going to move forward with it. But do you ever get like excited going, they have no idea how good this is going to be?
I get so excited on the inside because I just see their face. I see their bone structure. I see everything. It's like all the stars are aligned because I know this is going to be great. It's just getting the patient to be able to.
You don't think they get it sometimes?
Sometimes
like they don't know how good it's going to be?
Sometimes they don't get it. And I understand because of that baggage that they've had before in the past. They're scared. You know, they're worried. They're like, what if, blah, 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 filling all the different boxes of negativity that could happen. And we have to unpack a lot of those boxes.
Okay.
On the back of my head, I'm just thinking this is about to be gold. And for most of my patients, when we finally get to the end, when we get to the final zirconia set of teeth that are locked in, that stay in their mouth, they say, Doc, I wish I did this sooner.
Now, we're in a rush, and I know you have a stack of photos. We have about 2 or 3 minutes left.
Yeah.
So, and I know you want to show these photos.
Yeah, I could go all day. Here's another patient. She had missing teeth, loose teeth, lots of infection, a lot of discoloration with her teeth, just not happy with her smile and not happy with the ability or inability to be able to chew the foods that she liked.
Now, with this infection, you're calling it an infection like gum disease.
Yeah.
They can't brush or floss this out.
Well, they cannot because it's very deep within their gums, deep within their bones. So they're really not able to just brush it out, you know.
And are their gums good enough, though, to hold the implants if you have bad gums?
Yeah, so a lot of times the root cause of a lot of this infection is the tooth itself. So once we take the teeth out, once we're able to clean up everything around that infection's gone.
And the gums get healthy again?
Yeah, the gums get healthy again. Yes, sir. Yes, sir.
All right, so with this woman,
I
interrupted you.
No, you're good. So she came in, loose teeth, broken down teeth, not being able to chew, and not liking the aesthetics of her teeth. So she came in knowing that, hey, this is all that we do. She traveled 2 hours away with her husband just to see us. She came in and she said, we're here because we know that this is all you guys do. We see that you guys have glowing reviews. We trust you guys, and we want to work with you guys. So with her, we were able to give her a new set of teeth supported by dental implants, upper and lower. Now, just look at the 2 photos. Wouldn't you say she looks a little happier in her after photo? Maybe a little bit, younger, maybe like she
It
just
almost
gotta,
looks like that could be the younger sister or daughter of the before.
It does.
I'm not trying to exaggerate.
Sure. Yeah. It very much so looks like that. She actually got a new job as well, really being able to thrive in her life. And the thing that she wanted to come into her, she liked the way they looked. You know, she could not stop smiling.
Nice.
We saw her from day one from her post-op visit. Could not stop smiling, literally could not stop smiling. So she was very happy. She was able to chew the foods that she wanted to chew. So we're really able to unlock a new level of self-esteem.
Do patients ever say to you, doctor, you have changed my life?
Patients do say that. And I have to be real quick to correct them when I say, I did not change your life. You change your life. You change your life by saying yes, saying, hey, I'm tired of this and I want to change. I'm just a guide in the process. I'm blessed with skills to be able to make that happen, but really the patient.
So it's hard to make that first call because everybody's afraid of the dentist, right? Or they don't like the dentist.
Nobody likes the dentist. People say, Doc, I like you, but I kind of hate you at the same time, right? Because a lot of these patients, again, they have baggage when it comes to dentistry. But some patients, after we get to the finish, they'll say, Doc, you changed my life.
Now we are completely out of time.
You mind if I show you one more?
Okay.
I love this one really quick. Let me show you this last one. So this is Miss Danny. She is a ball of joy. She did not have any teeth. She did not have any dentures. And she really just wanted a set of teeth.
How does she eat like that?
She says she gums it. She gums her food and she's just not able to really chew the way that she wants. But she really wanted a set of teeth that she can smile with. As you can see in her before picture, really a bright face, a bright smile, even without any teeth, but she really wanted to complete it with a set of teeth.
Okay, so what did you do?
Now, we make some cosmetic dentures, so she wasn't at a point right now of being able to do any dental implants, hopefully soon. But even with her dentures, I couldn't get her to just take a straight-on picture. She had to pose in every single picture. She had to pose to the left, she had to pose to the right, she had to pose to the side, all these different things. She said, Doc, do you see my teeth? How can I pose just like take a normal picture when I have teeth like this? So this is the power of just having some of our cosmetic dentures. They're able to really be able to enjoy the way that they look and really be able to smile confidently again.
Very nice. Now, we are out of time. So, final message. There's two groups of patients. One is wearing a denture. The other one has really bad teeth and gums. They've heard what you have to say about getting new teeth with implants, but for whatever reason, they're still afraid, skeptical, whatever. What do you say to them?
I say, come in. I invite you in.
Okay.
Let's come see what can be done. Because truly and honestly, our consultations are complimentary. You know, you can come in, you don't have to be able to do anything. You know, if you can get in your car and drive to our practice, you owe it to yourself to at least be able to see what can be done. And
know
then
your
we can
options.
go from there. To know your options, and then we can see what
Then
can
we
be done.
should mention Medicare, Medicaid, even the best dental insurance doesn't really cover it, but you say people are financing this?
Yeah, so most of our patients do finance, just like you would do with the car or any other
You have to have OK
payment.
credit. Is that correct?
A lot of times you do have to have OK credit, at least. We do work with some patients who don't have the best credit. So we try to give them options at the end of the day.
Okay.
Because we know this is a bigger treatment. We know that they want to get it done. So we try to help them to get it done and to get them to where they want to be.
Now, at your center, do you see most of the patients for dental implants?
Yeah, so most of our patients come in.
They get to see you?
Yeah, so I see most of our patients who come in, just about every patient that comes in, I at least consult with them. Everything after there, I'm with them one-on-one. From their smile design, to their surgery, to their maintenance, everything they're seeing me.
Okay, good. Now, do you prefer they go to the website, make an appointment there, or just call?
Either one, whatever is easiest for you. Our job is to make this process as smooth and as efficient for you. I will say a lot of our patients do just give us a call. We have a great team up front who's going to welcome you, show you all the different steps to actually getting you into the office for your next appointment. So a lot of our patients call, but I say whatever is easiest for you. We just want to help you to get to where you want to be.
Okay, good. I want to thank you for coming on the show.
Yeah.
Good stuff.
Thank you for having me.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.